What if your heart suddenly cried for help, but you didn't recognize the signs? Every year, millions of people around the world are caught off guard by a heart attack, a life-threatening event that can strike without warning and change everything in a matter of minutes. It doesn't always look like what you see in movies. Sometimes it's not a dramatic collapse, but a quiet pain, a bit of shortness of breath, or just a feeling that something isn't right. And yet, acting fast in those moments can save a life. While modern medicine has dramatically improved survival rates, time remains the most critical factor. The difference between life and death often comes down to how quickly one acts. In this video, we'll uncover what really happens during a heart attack, what warning signs you should never ignore, and why early treatment can save your life. Whether you're concerned about your own health or someone you love, knowing the facts could make all the difference. A heart attack refers to the death of the part of the heart muscle due to the complete blockage of the one or more of the heart arteries. It is one of the leading causes of death in developed countries. However, survival rates have improved significantly due to early recognition, rapid transport to medical facilities, and the development of specialized coronary units. Today, most patients who reach a hospital alive have a good prognosis. The primary cause of a heart attack is atherosclerosis, which is the buildup of plaque in the heart's blood vessels. This plaque narrows the blood vessels, causing the problems when the vessel is about 75% blocked. At this stage, angina pectoris may occur, leading to intermittent chest pain and shortness of breath during physical activity, which typically eases with rest. If the plaque ruptures, a blood clot can form, completely blocking the artery and stopping blood flow to the heart muscle supplied by that vessel. Depending on the severity of the damage to the heart muscle, this can result in sudden heart failure and severe arrhythmias, which can be life-threatening. The main risk factors for a heart attack include age, as men aged 45 and older and women aged 55 and older are at a higher risk. High blood pressure can gradually damage the arteries that supply blood to the heart. Having a high level of low-density lipoprotein, commonly referred to as bad cholesterol, can lead to the narrowing of the arteries. Additionally, elevated levels of triglycerides, a type of blood fat, can negatively impact the arteries of the heart. Lastly, diabetes significantly accelerates the process of atherosclerosis, thereby increasing the risk of a heart attack. In many cases, the onset of symptoms is preceded by certain triggers, such as heavy physical exertion, exposure to cold, emotional stress, or illness. While a heart attack can occur at any time, symptoms often appear in the morning, a few hours after waking up. Common initial symptoms include dull pain under the sternum, which can radiate to the jaw, neck, left arm, and abdominal area. This pain is usually accompanied by a feeling of breathlessness and tightness in the chest, with the affected individual feeling as though someone is sitting on their chest. In some instances, symptoms may include stomach pain, nausea, and vomiting. Affected individuals often appear agitated, pale, and sweaty, and may change positions frequently to alleviate the pain. Pain can occur either at rest or during exertion. If it occurs during exertion, it does not typically subside with rest or the use of nitroglycerin. It is important to understand that individuals with diabetes may experience a phenomenon known as a silent heart attack, in which symptoms are minimal or even absent. Also, women may present atypical symptoms. such as brief or sharp pain in the neck, arms, or back. In a small number of cases, the first symptoms might include loss of consciousness, confusion, extreme weakness, palpitations, or an unexplained drop in blood pressure. For patients exhibiting classic symptoms, diagnosis is usually straightforward. However, for those without typical symptoms, it may not be immediately recognized, which can delay treatment and result in lost time. The initial evaluation typically includes a brief medical history review, a physical examination, an EKG, and, if necessary, laboratory tests measuring cardiac enzymes, which are reliable indicators of a heart attack. In uncertain cases, an ultrasound of the heart may be conducted to assess movement disorders in the affected heart wall. If the hospital is equipped with the necessary staff and equipment, a coronary angiography, that is imaging of the heart's blood vessels, can be performed to pinpoint the exact location of the blockage. A cardiologist manages the treatment of a heart attack. First aid may involve administering blood thinners to dissolve a newly formed clot and pain relief medications. If the patient experiences severe arrhythmias, controlled electric shock or defibrillation may be required. Upon arrival at a hospital equipped for cardiac emergencies, an imaging of the heart's blood vessels is typically performed, followed by clot removal and stent placement to keep the blood vessel open. The patient is then monitored in a coronary care unit, where they receive intensive care and continuous heart rhythm monitoring. The outcome largely depends on how quickly the affected individuals receives medical attention after the onset of symptoms. Prompt action is crucial for survival, as much time can be lost due to the patient's hesitation to seek help. The goal of treatment is to restore blood flow as quickly as possible, ideally within 90 minutes of symptoms onset. The sooner the blocked artery is reopened, the more heart muscle can be saved. If a patient reaches the hospital alive, the chance of survival is approximately 95%. However, it is important to note that about half of the heart attack victims do not survive long enough to reach the hospital. After treatment, most individuals can return to a normal life with regular therapy and follow-up checkups with a cardiologist. To prevent future heart attack, various measures are implemented, including strict control of blood pressure, blood lipids, and blood sugar levels, especially for diabetic patients. Additionally, moderate physical activity, weight loss, and smoking cessation are highly recommended. A heart attack is serious, but it's not always the end of the road. With quick action, modern treatment, and the right lifestyle changes, most people can recover and live full, active lives. The key is knowing the warning signs, not ignoring unusual symptoms, and getting help fast. And if you already had a heart attack, that's not the end, it's a wake-up call. Managing your blood pressure, cholesterol, blood sugar, staying active, and quitting smoking can make a huge difference. Your heart works hard for you every single day. Take care of it and it will take care of you. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.